objectives. This picture gallery gives you a preview of the criteria affecting CT image quality that we will focus on in the first part of this training. Contrast is one of the fundamental characteristics in any image. In CT imaging, contrast depends on the clear differentiation of CT values. The radio density of the scanned objects is quantitatively described in Hounsfield units. High contrast resolution is the ability to display high contrast objects in the CT image. It is influenced by the system geometry and determines the sharpness of the image. High contrast images offer great differences in tissue density and are required for good image quality in bone and lung structures. High contrast images also suffer from high noise. Therefore, scanning at a low dose is required. On the downside, high contrast images do not offer sufficient differentiation of small variations in tissue density. Low contrast resolution is where the slight differences in contrast are significant. It is required for good image quality in soft tissue, where sharpness and noise are factors that should be considered. Low contrast images offer great differentiation in soft tissue organs, such as liver and brain. Temporal resolution is the time required by the CT scanner to generate the data for an image. It is determined by the rotation time of the gantry. The shorter the acquisition time, the lower the occurrence of motion artifacts. For cardiac examinations, a 180-degree rotation of the gantry is sufficient to produce an image. In order to calculate the temporal resolution of a single-source CT scanner, we have to take the fastest rotation time and divide it by 2. For dual-source scanners, the fastest rotation time must be divided by 3.75. High temporal resolution is required for clinically stable images. The faster the rotation time of the gantry, the higher the temporal resolution. Sharpness describes the sharpness of an object in relation to the surrounding tissue. It depends on rotation time, kernel, slice thickness, and radiation dose. Noise is superimposed on the image and leads to a snowy impression. The intensity of noise in the image is influenced by the number of X-ray quanta reaching the detector, thereby contributing to the generation of the CT image. The number of X-rays or quanta reaching the detector is determined by tube current and voltage, slice thickness, collimation, kernel, and the thickness of the object. Artifacts are various patterns and structures that appear in the CT image, although they do not exist in the original object. Take a look at the list of the most common CT imaging artifacts we are going to discuss, and their major causes. The first type of artifact presented here is the so-called motion artifact. As its name indicates, this artifact appears due to the movement of the patient during the data acquisition. Short scanning times help to avoid this artifact. If an object is not located in the center of the radiation beams, the isocenter, it cannot be detected in the same spot by each emitted X-ray beam, thereby causing the partial volume artifact. This is especially a problem if very dense structures are only partially included in the slice. This artifact manifests itself in the CT image as stripes. It is very common when scanning heads, particularly in the area at the base of the skull. Partial volume artifacts can be reduced by using a smaller slice thickness. By selecting thinner slices, artifacts of this type are decreased, since the probability of high-contrast structures only partially reaching into the slice is lowered. However, the selection of thinner slices will also lead to higher noise in the image, and consequently to a decrease in the low-contrast resolution. This CT image of a small lung nodule makes a strong case for using overlapping slices to prevent the partial volume artifact. In the two adjacent slices without overlap, the CT value of the nodule is underrepresented, and the object might be overlooked. In the three consecutive slices with 50% overlap, the nodule is clearly visible in the center slice. The beam hardening effect is illustrated in the drawing. The length of the arrows represents the variable energy of the X-ray quanta in the emitted radiation beam. Low-energy quanta are selectively attenuated in the object, and the resulting X-ray spectrum shifts to higher energies. This effect is called beam hardening. The beam hardening artifact is corrected automatically by the system. A selection between bone or iodine beam hardening is possible. If too many detector elements are defective, a ring artifact of the type seen in the images will appear. One or several calibrations can be done in order to try to eliminate this artifact. If the problem persists, calling the Siemens Healthineers service hotline is the only option. Stripe artifacts appear in the image as a result of a problem in the image reconstruction system, the IRS. There is nothing the user can do to solve this, and a service call is the only option to get the problem fixed. Metal artifacts appear when the scanned region contains metal. Metals, such as gold, can absorb the X-rays almost completely, leading to stripe artifacts in the reconstructed image. This artifact can be reduced by using sharp kernels, by scanning with high kV, or by the use of IMAR technology. Iterative metal artifact reduction reduces metal artifacts, caused, for example, by implants, artificial joints, or pacemakers, in various body regions without the need to increase the radiation dose. Evaluation of higher density metal objects like hip replacements is possible with the use of the tenfold extended CT scale. Extended CT scale is an option in Summaris 5 and 7 scanners, but it is not available in Summaris 10, since the scanners in this group have a wide-ranging CT scale that is always active. This picture gallery gives you a preview of the next major topic, the factors that influence CT image quality. Decisive factors are the actions of persons, such as the system user and the patient, as well as the technical setup, such as the system status and the CT parameter settings. The image quality is affected by technical parameters. CT scanners must be calibrated every 24 hours to ensure good image quality. If no calibration is performed, individual detectors can produce different signal amplitudes at the same radiation intensity, and the already mentioned ring artifacts will appear in the images. A new feature in Summaris 10 scanners is that a calibration reminder will pop up 1 hour after the checkup. After this calibration, no further calibrations are needed for the day, unless problems like ring artifacts occur, or the system gets restarted. The scanner user can also affect the image quality. It is the user's responsibility to ensure a correct patient preparation and positioning, select the appropriate clinical protocol, and adjust the parameters accordingly. The scan and image reconstruction parameters are key to obtaining a good image. Among others, milliampere second, MAS settings, kilovoltage, kernel, slice thickness, scan time, and field of view affect the image quality. In soft tissue diagnostics, the representation of small structures with low density differences requires high MAS settings. Since the CT values of surrounding tissue are very similar, noise in the image must be kept to a minimum. In order to display small structures with large differences in density, as is the case in high-contrast diagnostics, low MAS settings are sufficient. Since the CT values of the structures of interest are very high compared to surrounding tissues, some level of noise is acceptable. Low MAS values lead to noisy images. The graph shows the correlation between radiation dose and noise. The rule of thumb is, the higher the dose, the lower the noise. The higher the voltage, the more the spectrum shifts to higher energy levels, leading to a lower attenuation of the X-ray beams. High kV deteriorates the contrast in the image, giving rise to the radiographer's expression, kV turns gray. Kilovoltage settings have a great influence on the patient dose. As you can see from the correlation between noise and image definition in the graph, and the comparison between the two CT images of the lung, smooth kernels deliver low-definition images with low noise. Sharp kernels deliver sharp-definition images with high noise. The choice of slice thickness is a compromise between edge sharpness and noise, as they influence each other. Thicker slices offer lower noise and better low-contrast resolution, while sacrificing edge sharpness. Partial volume artifacts are more common when using thick slices. On the other hand, thin slices offer better edge sharpness and better high-contrast resolution. Partial volume artifacts are less common, but the trade-off is that images will have higher noise and poor low-contrast resolution. As you can see in the images, thicker slices have less noise and better contrast in soft tissue studies, and thinner slices have much better geometric resolution. The scan time determines the speed and temporal resolution of the acquisition. This graph shows the correlation between scan time and the occurrence of motion artifacts. The shorter the scan time, the less likely motion artifacts are. The last parameter we would like to address is field of view. The selection of appropriate field of view values has a big impact on the optimal visualization of image details. The raw data is always recorded from the entire measuring field. Consequently, an image selection can be calculated from the raw data, just as the image detail can be calculated anywhere within the 500 mm field of view. Let's now compare using the magnification tool, that is, the optical zoom function, with performing real reconstruction directly from the raw data with a smaller field of view. As you can see in the two CT images from the lung, purely optical enlargement of the image data, or zoom, leads to a blurred image impression, while real reconstruction with a smaller field of view shows improved detail sharpness. Image quality is also influenced by the patient, especially by the patient size and the patient cooperation. The image noise doubles for every 8 centimeters that the patient's diameter increases. Patient cooperation is essential for achieving a good image quality. Bad cooperation might necessitate adjustments of scan parameters, which in turn might affect image quality. As an example, Shorter scan times will help with the CT exam of patients who cannot hold their breath for a long time.